Welcome to my presentation. My population is alcohol, misuse, abuse, and addiction, and the health concerns within this population. Historically, our society has treated alcohol, misuse, abuse, and addiction as a way to cope with symptoms of moral weakness or reject societal norms. Alcohol-related harms contribute to the loss of earnings, family disruption, interpersonal violence, mental health issues, and stigmatization, thus shaping social determinants of health, which include socioeconomic status and exacerbating inequities within the population. The size of the population locally in the Wasatch Front shows 8.2% of adults are binge drinkers, while 4.8% of adults are heavy drinkers. Statewide in Utah, we have 11.1% of adults as binge drinkers, 3.9% of adults as heavy drinkers. Our national in the United States is 16% of adults binge drinkers and 7% of adults are heavy drinkers. And internationally, we have a global average of 6.4 liters per person ages 15 and above, and it causes 2.8 million premature deaths per year. Here's a chart to show the size of the population and the difference in the population locally versus nationally. You can see alcohol consumption by adults locally in the Wasatch Front in orange and the national in the United States here in yellow. The yellow is quite higher than the orange. Some contributing factors and social determinants of health include education access and quality, peer pressure, being undereducated. Another one is neighborhood and built environment. The neighborhoods have high crime rates and lower household income or low education levels. Social and community context, which is like witnessing domestic violence either in or out of the home. Economic stability, which could be stress from a job. Those people tend to want to go home and wind down after work, and their choice is to use alcohol to use that as a winding down. And healthcare access and quality. This population is less able to afford healthcare than others. Some special concerns and contributing factors. Some physical concerns would be development of chronic diseases, psychosocial issues like stress, anxiety, depression, and numbing one's pain, and then just letting themselves go, not feeling wanted. Economic status. Some of these would be ease of access to healthcare, groceries, and exercising, and then employment is another one. And then next we have socioeconomic group, which is low-income households, homelessness, and loss of employment among this population. Some root causes to this would be physical effects on the body. There are long-term damage to organs and diseases that alcohol can cause. Another one is societal effects, which is burning bridges with friends or family members. And the third one is transportation. This population is more prone to getting DUIs, getting their driver's licenses revoked, and even spending time in jail. Maslow's hierarchy of needs and the needs that are met and unmet within this population are shown here. Some met needs are the physiological, including breathing, sleeping, eating, and drinking water. And another one is safety, so having family and maybe having employment. These two things just may not be stable. And the unmet needs within safety would be employment, again, property, and possibly family not being there for them. The love and belonging need is unhealthy friendships, intimacy, and loving oneself is usually not met. Esteem is an unmet need, and it's lower self-esteem, no confidence, and not truly feeling respected within the population. And self-actualization is the other unmet need. And this need isn't met until all other needs are met. So this population is usually not one to meet the self-actualization level. Some anticipated functional level of this population would be physiological needs would be the only need met by some or most of this population. Again, if the first need isn't met on this hierarchy, an individual can't meet any other needs in the hierarchy. And likely health outcomes, chronic diseases include high blood pressure, liver disease, diabetes, stroke, and cancers. Psychosocial issues include anxiety and depression. And suicide and death may occur as well. Communicable diseases or infections and specific concerns within this population. Alcohol misuse, abuse, addiction are increased risk for the following: HIV and AIDS, pneumonia, tuberculosis, hepatitis B and C, other respiratory infections, and other diseases. Long-term use of alcohol can weaken the immune system and increase the risk for bacterial infections, viral infections, and other infectious diseases among this population. How to decrease transmission and acquisition of communicable diseases and infections. You'll want to wash your hands with soap and water frequently. Avoid sharing personal items, including razors, toothbrushes, and nail clippers, with an infected person. Keep good hygiene. Cover your mouth when you cough or sneeze. Staying up to date on your vaccinations. Practice safe sex, and also practice food safety and safe handling of food. Non-communicable diseases or infections and specific concerns within the population. This includes damage to your organs, including pancreas, which you could get pancreatitis, that is inflammation of the pancreas, has damage to your gastrointestinal tract, and can lead to infections with ulcers and change of the normal bacteria. Damage to your brain, including hemorrhagic stroke and neuropsychiatric disorders. Damage to your heart, including cardiovascular diseases, hypertension, and atrial fibrillation, diabetes, and another big one is damage to your liver, which includes alcoholic hepatitis, a fatty liver, which can lead to cirrhosis and even death or having the possibility of getting transplanted. Prevention and management of non-communicable disease and infection. Preventions would be to just stop drinking alcohol altogether, and that would be abstinence. The next one is effective alcohol policies should be implemented. Another one is individual choice of getting into recovery. That would include the therapy group, which is the next one, as in AA meetings, and reducing the amount of alcohol that you consume. Some management would be if or when diagnosed with an infection or disease from alcohol use. That'll just depend on the diagnosis that you get, and some of the management could be medication management that you need to be on, regularly attending doctor's appointments, and again, abstinence from alcohol, which means quitting. Specific concerns with self-care deficits and self-harm. So self-harm and self-care deficit risks are increased due to the causes of alcohol use and negative coping mechanisms. Alcohol use causes poor judgment, mood instability, major aggression, and even impaired judgment. And some negative coping mechanisms will include frustrations, depression, stress, and some personal issues. Risk of harm by or to others. So vulnerability to date rape or sexual abuse is higher with this population. Driving while intoxicated can cause car accidents leading to injury and or death. Domestic violence is increased, an increased likelihood of committing violent crimes, and an increased likelihood of being a victim of a crime. So that is going to conclude my presentation on alcohol misuse, abuse, and addiction. And I just want to thank you all for being here today and listening to my presentation.